Welcome to Evidence Mastery with Dr. Masood Tusi. I am going to help you understand what type 2 diabetes is and how it is managed.
Please note that this video is for education only and will not replace your doctor's advice.
So in this explainer, we're going to walk through 6 key areas. We'll start with the basics, what type 2 diabetes actually is, and we'll work our way through to the future of its management to give us a really complete picture. All right, let's dive right into our first section. So what exactly is type 2 diabetes? Okay, so at its very core, type 2 diabetes is all about how the body handles sugar, or glucose, which is its main fuel. There are really 2 big problems going on. First, the body doesn't respond properly to a hormone called insulin. And second, over time, the pancreas, which makes that insulin, just can't keep up with the demand. And to really grasp the scale of this, just look at that number, 422 million people worldwide. That's a staggering figure. And all the evidence suggests this is only going to keep growing, which makes this one of the biggest public health challenges we're facing today. Now, this is so important to understand. When most people say diabetes, they're really talking about type 2. As you can see here, it makes up a whopping 90% of all cases. It's completely different from, say, type 1 diabetes, which is an autoimmune condition. Okay, so now let's get into the why. What's actually going on inside the body? To really get a handle on type 2 diabetes, we have to zoom in and look at what's happening at the cellular level. The root cause, the fundamental issue here, is something called insulin resistance. The best way to think about it is this. Imagine insulin is a key. Its job is to unlock your body's cells to let glucose, the energy, inside. Well, with insulin resistance, it's like the locks on your cells get all rusty. The key doesn't turn as easily, so the glucose can't get in where it needs to go. And this right here shows you the result of that rusty lock. On the left, you see how it's supposed to work. Insulin does its job, glucose gets into the cells, and blood sugar stays nice and balanced. But on the right, with type 2 diabetes, that signal is broken. The glucose is essentially locked out of the cells, so it starts to build up in the blood. That's what we call hyperglycemia, or, high blood sugar. And it's really important to know this doesn't happen overnight. It's a progressive thing. So in the beginning, as the cells start to resist insulin, the pancreas it works harder. It pumps out more and more insulin to try to force those rusty locks open. But it can't keep that up forever. After years of working overtime, those little insulin-producing cells in the pancreas, they're called beta cells, they get worn out, they get exhausted, and their function starts to decline. And that's when you get less insulin and the high blood sugar gets worse. Okay, so now we get the how. Let's talk about the who and the what. Who is most at risk for this? And what are the warning signs the body might be giving us? Right, so the evidence points to a few key risk factors. Some of these things you just can't change, like getting older or having it run in your family. But a lot of them are really tied to lifestyle. For instance, carrying excess weight, especially around the midsection, is a big one. That extra body fat isn't just sitting there. It can actually release inflammatory substances that mess with insulin's signal, which, as we just saw, is what drives that insulin resistance in the first place. So, when the sugar in the blood gets high enough, you might start to notice some symptoms. The classic ones? Frequent urination and being really thirsty. That's basically your body trying its best to get rid of all that extra sugar. But here's the really crucial part. These symptoms can be super subtle at first, easy to ignore. And that subtlety is exactly why someone can have type 2 diabetes for years and not even know it. So that leads us to the next logical question. How do we actually diagnose this? Well, it all comes down to a few very specific lab tests that help us identify it and then track it over time. The diagnosis isn't a guess. It's based on really clear, evidence-based numbers. One common test is the fasting blood glucose. That's just checking your blood sugar after you haven't eaten overnight. But an even more powerful test is the hemoglobin A1C. Think of it like a batting average for your blood sugar control over the last 2 or 3 months. And as you can see in this table, there are very specific numbers that tell us if someone is in the prediabetes range or if they have a formal diagnosis of diabetes. And once someone is diagnosed, that same A1C test becomes our go-to tool for monitoring. It tells us how well things are being managed. Now, for most adults with diabetes, the target we aim for, based on a mountain of evidence, is an A1C below 7%. Why that number? Because we know that keeping it below 7 dramatically lowers the risk of long-term problems.
Of course, it's really important to remember that this goal is often personalized by a doctor based on a person's individual health situation.
So that brings us to management. And this is key. Managing type 2 diabetes effectively is about so much more than just medication. It's a whole comprehensive strategy. You can think of it like building a house. It rests on several strong pillars. The absolute foundation is education. You have to understand what's going on. Then, on top of that, you have personalized nutrition, regular physical activity, and maintaining a healthy weight. Now, medications are definitely an important tool in the toolbox, but they work best when they're used on top of this solid lifestyle foundation. And really, you just can't overstate how powerful these lifestyle changes are. We have landmark clinical trials showing that even pretty modest goals, we're talking about something like a 7% loss in body weight, combined with about 150 minutes of exercise a week, can cut the risk of a person with prediabetes developing full-blown diabetes by more than half. That is just incredible. All right, for our last section, let's look at the bigger picture. We'll talk about why all this management is so critical by looking at the long-term complications. But we're also going to end on a really hopeful note, looking at how much treatment has evolved. So, the problem with having high blood sugar over a long period of time is that it's just really tough on your blood vessels. It damages them. We usually break this damage down into two categories. First, there's microvascular damage, which affects the tiny, delicate blood vessels in your eyes, kidneys, and nerves. And then there's macrovascular damage. This is the big stuff, damage to the large arteries that can lead to heart attacks, strokes, and circulation problems. And that brings us to what is really the most serious complication of all. I mean, the evidence here is just crystal clear. Having diabetes at least doubles your risk of having a major cardiovascular event, like a heart attack or stroke. And that is why protecting the heart has become such a central, critical goal in how we manage diabetes today. And this really gets us to the most important takeaway. We're in the middle of a massive shift in how we think about treating this disease. For decades, it was all about one thing: get the blood sugar down. But now we know that's not enough. The whole game has changed. Today, the focus is on choosing therapies that not only lower blood sugar, but that also have been proven to protect the heart and the kidneys. We're not just treating a number on a lab report anymore. We're focused on improving long-term health and ultimately survival. I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel.